Most of us have heard the term tennis elbow, and you usually think about sports when talking about this injury. Despite the name, however, tennis elbow affects a wide variety of people, whether or not they're athletes.
So the official term for it is lateral epicondylitis. So there's a bone on the outside of your elbow that a lot of the muscles that work your forearm, wrist, and hand attach to. So what happens is they get overused, they get strained, they get injured in some way, and there's an inflammation that develops.
Terry Hamp is a physical therapist with Dynamic Physical Therapy. She says that the symptoms of tennis elbow can be painful and may limit the use of the affected arm.
They usually have quite a bit of tenderness right on the outside of the elbow, the bone right there. So they'll often say, oh, if I even touch that bone, it's just killing me, or right through the forearm. So also there's some tests that we can do that isolate that pretty specifically. So it's easier for us to differentiate what muscle is involved and things like that. But the other thing too is that it starts to affect the grip, fine motor skills, typing, writing, picking up small objects. They'll say they want to drop things a lot because it just hurts to grip.
It isn't just tennis players who experience this type of discomfort. Almost anyone who performs repetitive motions can experience frustrating inflammation.
I see a lot of it in some factories with small motor, fine motor skills that they're doing, packing, counting, sorting, where they're constantly working with their hands. So that's one thing. Also, but I see it in a lot of office workers too at times. But it kind of goes all across the board. Sometimes I'll see it too in construction workers that are using a hammer a lot, power tools, vibration, if they're using something to break up concrete, or the rechargeable power tools or any type of power tools, that vibration can really cause some irritation there too. So it's really something that anyone we can see it with.
As with many injuries, one of the best ways to deal with tennis elbow is to prevent it in the first place, and moderation is the key.
A lot of it is stretching, the ice, moderation of activity. And one thing that I'll tell people is, I know if you've got kids and you've got to lift them and you've got to finish cleaning that room and mopping and vacuuming, take breaks, go change and do something different. Go mop this floor and then fold some clothes and then cook dinner and come back and do something else. And while that takes longer, you're putting less stress on that area, and you're really going to help yourself in the long run when you moderate what you do in this type of injury.
When prevention doesn't work, there are several basic home treatments that can help reduce the symptoms of inflammation.
Icing is always good because it's going to cut the inflammation down, and stretching those muscles out is always something good. I always say strong but comfortable. You don't want to stretch into pain. So it's something that you could get a nice, strong but tolerable, comfortable stretch with. If it gets too painful when you're stretching, everything is just going to reflexively tighten up, and we're not going to make any benefit that way. But when you stretch, I want people to stretch usually for a good 45 seconds to a minute to really get that good stretch in there, and it's going to maintain better and it's going to last longer. So those are some good things, and resting it. Don't overuse it. Don't push through the pain. It's just going to cause more inflammation. So you want to try to, if you can, take a break a little bit.
And when home treatment just isn't enough, physical therapy professionals like Terry are available to help speed up the recovery process.
We really try to work on improving the flexibility in those muscles, in the forearm, in different directions, and working on some pain-free range of motion of the wrist and the elbow so that we can get those muscles working and pumping and getting good healthy blood flow through them, so that we can get some good healthy healing in there and restart that healing process. Because a lot of people we see have been dealing with this for a long time, and there's just this chronic inflammation that's kind of stalled out and it hasn't gone through the full healing process. So we really want to restart that, get things moving again so that it can finish its cycle and people can get back to less pain.
For My News 26, I'm Kayla Kiley.